I'm Catherine Thomason, and I'm doing this because I think we can find the answers. I really do. We're all going to have to work doubly hard and use these health stories that Wendy just told you that apply to all those white, overweight policymakers, or any policymakers, the examples that she showed you, that tell people that it's going to impact them. It's not now just going to impact their children. It's going to impact them. So what I'd like to cover is that the solutions are also the solutions for our health problems as well. So there's benefits to clean renewables, energy efficiency, and I'm going to go over one aspect of the solution that I'd like you to walk out of here today with, and that's the EPA Clean Power Plan and what we can do about that to make it better, and also what you can do so that you feel empowered to take action. So let me ask you all, what's the cheapest energy out there?
Coal.
Coal, someone said? Other ideas?
The sun. Wind.
Solar, wind,
Water. Efficiency.
efficiency, bingo. Energy efficiency is the cheapest form of reducing our carbon footprint. It does cost money. We have to pay for upgrades. We're not talking about just turning off the lights, which of course our parents all told us to do. We're talking about truly reducing how much electricity we need because we can be more efficient. So it's about 2.5 to 2.8 cents per kilowatt hour. Make sure my numbers are right. All right. So there's a study put out by the Southwest Energy Efficiency Project that stated we can invest $17 billion from now until 2020. We will save $37.1 billion, both in health benefits as well as in reduced energy costs if we make this investment. So it's a net benefit of $20 billion. How many people read Paul Krugman's article today in the New York Times about how the solutions aren't going to wreck the economy? Bravo. It's not. There are many wonderful solutions. So what did they look at? They looked at the best practices. So one of the best practices is already in place in many places, and that's actually providing low-income homes and apartments with weatherization and efficiency upgrades. Another is multifamily retrofits. So this glowing picture of the building back here shows where the energy is seeping out of the building, whether it's cooling or heating. And this worker over here, which we're going to have so many new jobs from doing this kind of work. Putting in insulation to prevent all the seepage of electricity, heating and cooling that are going right out the window and the walls. So there are many examples of best practices. There's about 10 of them. We can go over some of them in the question and answer period if you'd like. But of course there's commercial and industrial. There's actually more potential savings on the commercial and industrial side, and actually there's been more action taken on that side as well. One of the best practices again is to pass better codes. The better codes teach the home builders and the construction industry with training programs on how to make a better structure that's more energy efficient right from the beginning. And teaches home buyers that they want to look for an energy efficient building because it's going to cost them less money. And there are a whole variety of others. Now, why aren't these being done? Why do you think? Yeah.
High money on the front end.
High money on the front end, right. Why else?
It's not sexy.
It's not sexy, absolutely. Who likes putting insulation in? Not me. I'd rather have solar panels on my roof.
The utility companies think they'll lose.
The utility companies profit by selling more electricity. Okay, so the states that have decoupled the profits and the outcome for the utility company from how much electricity they're producing and instead awarding them for reaching targets that produce more energy efficiency. Those are the places they're going to have more energy efficiency. It only makes sense. A lot of these programs currently are financed through utility fees. Michigan has instituted a wonderful program that's nearly put in 10% energy efficiency by next year through assessing a 3% increase in utility. Now, it's only going to take a couple of years for people in that state to start seeing a reduced electricity bill. Another new one, 31 states have a financing program that's legislated to be allowed. In other words, states, pension plans, individual donors, companies can actually invest in bonds that homeowners and business owners can take a loan from and pay it back through their property tax every year. That can be sold with the house. So that you can do these more expensive retrogrades, putting in windows, more than just the insulation kinds of features. It's not instituted in all the 31 states. I actually looked up my former home in Oregon, and they've done a couple pilot programs, but they haven't really instituted this yet. So we need to demand it. What are the benefits of energy efficiency? Shout it out.
Less pollution.
Less pollution. We're going to reduce our carbon footprint.
Save money.
Save money, absolutely.
Jobs.
Jobs. Lots and lots of jobs, absolutely. So we have jobs putting in insulation, doing energy audits, providing training programs, putting up the various sorts of programs and program support. Actually, it has been shown that large-scale energy efficiency programs reduce wholesale electricity prices. Just brings them down. There's less demand. So that sweep study I showed you before from the Southwest can reduce up to 20% by 2020. What's the goal in the EPA rule? It's 30% by 2030. And therefore would retire 4,407 megawatts of coal. So it's going to improve our health. We'll have less particulates, less heat, less mercury pollution, and all the things that come from burning fossil fuels. So that's energy efficiency. Now, we all want clean energy as well, don't we? I mean, we want to turn the lights on. That's the big worry. And so one of the alternatives is wind. U.S. actually ranks second in the world for installed wind capacity. Most of us don't know that, which counts for about 4.5% of the total electricity demand as of 2013. The price of wind energy is now lower than coal. Okay? 2.5 cents per kilowatt hour. Texas, go get Texas. Texas is the leader with the most installed wind capacity, has fantastic wind, followed by California, Iowa, Illinois, Oregon, and Oklahoma. Now, the other point to take is that Iowa has been relying 27% of its electricity comes from wind because it's a lower per capita, but still, the lights didn't go out. They're a very good wind state, and 27% of their capacity comes from wind. How about solar? I love this graph. Okay, I didn't like this graph when it was a picture of CO2 emissions going up, but I like this graph when it's a picture of solar going up. Look at the steep curve there. This is, the graph is actually at the end of 2013. The end of the second quarter of 2014, we had 16,000 megawatts or 16 gigawatts of solar energy in this country. There's a new 1 gigawatt per quarter that's being installed in the United States. Half of that is in California. So they have instituted AB 32, they have policies in place that provide incentives to say we need clean energy. And the majority of states have renewable portfolio standards as well. So these policies help drive, as well as the reduction in costs, help increase the amount of clean energy that can and should be produced. How many workers? 143,000 workers in the solar industry in the United States. Quite a big number, displacing coal workers with training programs, miners who are getting black lung with training programs is absolutely essential to transition to a clean energy future. Solar is still more expensive than coal. Can't get around that. However, we do have incentives. So we have the federal solar investment tax credit that is still on the books and is planned to be on the books for a significant period of time. Many states still have net energy metering for both individual wind as well as for solar. There's a modified accelerated cost recovery system. Now what does that mean? That means if you have a building or a business and you put some major capital upgrade, normally you have to depreciate that over 15 to 28 years, depending on how it's defined. Well, this way it gets to be depreciated over 5 years. So there's a financial benefit to depreciating that sooner. Because that's about when you see the benefit, is after about 5 to 8 years. And the prices are going down. I paid about half this last year putting on solar panels in DC than I did 6 years ago in Oregon. I think it's also important we always think about solar as being an individual, homeowners kind of project, but in actuality, the utilities are on the bandwagon, especially when they're forced to be by policy. So if you look at this graph, you can see that the top part, the dark blue, is residential. The dark blue is non-residential, and the light blue is the utility. In other words, the utility is actually building solar farms, whether it's concentrated solar, solar thermal, or actually solar arrays to produce clean energy for their customers. Okay? It's really being driven in California, but in reality it's happening in many places. Now, do the lights go out? That sun goes down at night. Do the lights go out when the sun goes down? In actuality, no. The highest demand is during the day. The highest demand is with air conditioning. The highest demand in industrial and commercial is during the day. So Germany, the last 2 summers, were 50% on solar and wind. The lights did not go out. And in fact, they had a 3% reduction in CO2 over the last 3 years since 2011, in spite of closing 8 nuclear reactors. So we can have it both ways. Obviously, they have really created a lot of incentives to create the possibility to have that much solar, and that's what we need to do too. So what are we going to do about this? We don't listen to all this hot air, this disinformation, climate change denial. No, we're not. We're going to talk, we want a healthier air, we want healthier water, we want a clean energy future. We don't even, unfortunately in red states, we don't even have to talk about climate change. We can talk about having a clean, healthy energy future. So, what about the EPA carbon clean power plan? How many people know about this? How many people have already commented? Oh, fantastic. Good. So Gina McCarthy is my EPA hero. This is her signing the rule. You notice how big it is? Great big stack of papers there that everybody's been riffling through to try and write their comments. The goal is modest. It's not going to get us where we want to get. I can't say it will, because it won't. It's a 30% reduction by 2030 from 2005 levels. Okay? There are states way beyond that. Washington State, for example, is beyond that. However, it applies to every single state. Does it apply equally? No. And that may be its salvation because it's flexible. So there are guidelines and targets that were created for each state based on 4 potential calculations. The first one is that most coal plants can become more efficient. with some upgrades. And the maximum they can do is about 6%. So we can make burning coal a little bit more efficient so that it won't produce as much carbon per amount of electricity generated. The second is that they will count changing over to natural gas, because natural gas at the plant, when it's burned, produces half the carbon dioxide of coal at the plant. Now, we don't like natural gas. I'm sure that you guys don't like natural gas because methane is a stronger greenhouse gas. So hold that thought. It also says you can pick any of these if you can meet your target with them. You can pick energy efficiencies. You can pick energy efficiency, which is number 4, but you can also pick renewable resources, but they also include nuclear in that. But they used those and calculated the amount each state they felt reasonably achieve without too much outlay of money to get to a reduction. Now, we know that a lot of states are moving along that path and that there are other ways of doing this, like putting incentives in place. So putting incentives like AB 32 I mentioned in California, the Northeast Regional Electric Reduction, those are all possible as well under the plan to meet the goal of 30% reduction. As I said before, not every state has to meet that target. Some states like Washington have agreed to reduce much farther than 30%. They're the top one. Down there at the bottom is North Dakota, in case you can't read that. North Dakota has no policies in place for energy efficiency. Maine, however, is at the bottom as well because they have reduced significantly already through the RGGI program and don't have as much coal to reduce. And then, of course, this is the flip on the curve in terms of how much are they actually going to achieve, and we don't need to get into that. But the EPA rule costed what would it cost to do these kinds of changes? And they estimated about $100 billion to U.S. That the cost of the upgrades are $7 to $8 billion across the entire country. Climate disasters alone cost $100 billion to the United States in 2012. I think that's a pretty good price tag, personally. The benefits, of course, are the same benefits we've talked about. So reducing particulates, reducing pollution. Climate and health benefits are 55 to 93 billion by 2030 annually. Reduced premature deaths, asthma attacks, and of course, a reduction in our electricity bills. So, based on all that I told you, do we need natural gas to achieve these targets? No, we don't. We can use wind. We can use solar.
I just mentioned earlier that air conditioning was one of the biggest problems with producing usage. Yes, and then I mean, I think air conditioning is all operated off of natural gas.
A lot of it's operated off of electricity.
Oh.
Yeah. Heating is often natural gas.
Okay.
But air conditioning is with the electrical system. So, what would I like you all to do? I would like you to comment on the EPA rule. So all those people who didn't raise their hand, they can take the handout that talks about the health effects, turn it over on the back, go to PSR's website, read some more about the EPA rule, because this is just a real flyby, and we can talk about that some more, but put in some comments. Comments can include, we can do this, we should do more, we can do it with electrical energy efficiency, first and foremost, and clean energy second. We don't need new nuclear, and we don't need more natural gas plants. Simple. You've sent your comment in. Press send, and you're good to go. There are 1.5 million comments that have already come in. The goal is about 3 million, so I'd like to see us hit that goal. The extension, they have created an extension to December 1st. It was previously October 17th. But they did not extend when the rule had to come out. So the rule has to come out in its final form by next June. I'm not going to go over those. The second thing that you can do, and I'm sure all of you are involved in organizations on climate change. If you're a health professional, if you want to speak with a health voice, if you know of other health professionals or people who are concerned about health, create or join a PSR climate action team. Okay, so join up with PSR as an organization. We're going to be holding monthly webinars. Our first one is on October 1st, where we're going to talk about social media for all of us white-haired people who don't know about those kinds of things. You can learn about it, learn how to tweet yourself. But in reality, this is what attracts journalists and attracts stories and attracts younger people to our movement. Each webinar will provide either a new skill or new information, and teaching people how to advocate for this EPA rule. Because once the rule comes out, and even before the rule comes out, our state legislators need to hear from all of us that we want a state implementation plan, and we want it to look like what we just talked about. We want energy efficiency and clean renewables. Every state is going to be required to come up with a plan. If they don't, the federal government will hand them a plan. So if you get in to talk to people who are kind of against this, you can say, you know what, would you rather create your own plan here, or would you rather have the federal government tell you what the plan should be? Okay? So feel free to join us as we work on this plan and make it the best possible for every single state, because our legislators need to hear from us. So by telling stories about how climate change impacts your health, your legislators' health, your grandmother's health, your child's health, you will get the attention of the policymakers. You will get your letter to the editor in the paper. You'll get your opinion editorial in the paper. We have to tell stories about real impacts and real health issues so that people understand climate change is here and it's a health crisis. And the best thing is that we have solutions that will make us all healthier. So the main things I hope that people got out of today's talk were some of the main health impacts of climate change. Heat waves cause more deaths up until Hurricane Katrina. Air pollution is a serious impact, and extreme weather costs and health impacts last for years, if not decades. So Charity Hospital in Louisiana that took care of the low-income folks throughout the entire state was never rebuilt. That's a huge health impact for the state of Louisiana. There are many co-benefits of reducing our fossil fuel burning. We can talk about those instead of climate change when you're in a person's office who doesn't necessarily agree with us. And the action items. So, Bob is going to talk a bit as well about health care issues, and then we'll open it up for questions and answers.
Okay, I am going to try to go very quickly through a bunch of slides, but I'm coming here from California, but I was born in the Gun Hill Projects, so I can speak very fast, and I will, to go through this. So I was going to take a little...
Just press quit.
Press what?
Quit.
Okay. I was going to take a much narrower focus. I think we've had a lot of information here in terms of what the health impacts of climate change, and Catherine did an excellent job of going through various modalities in terms of policy, different types of energy choices we can make, etc. And I was going to just focus on the role of health professionals, in particular as a sector, and changes that are occurring both at the level of individual physician and other health professional organizing, as well as institutional work that's been going on that helps to support the sort of policy initiatives that Catherine and Wendy were addressing. So just to give a little background on PSR's role on this, we have been around for over 50 years, and our basic motto here is that we are guided by the values and expertise of medicine and public health. We work to protect human life from the gravest threats to health and survival. Many of you here know about our work that's been since our inception, which we continue in terms of combating the threats of nuclear weapons. But as much, we've been working since the early 1990s because of things like this we see among our colleagues. And this is the Lancet weighing in a number of years ago. Climate change is the biggest global threat of the 21st century. The impact will be felt all around the world, not just in the distant future, but in our lifetime and those of our children, which gives us our charge as health professionals to take a very strong stand, particularly at a time when this has historically been so politicized and health is a real wedge issue for which we can speak up about. Our leaders such as Alexander Leaf, who was one of the founding members of PSR, took our organization in a new direction to expand beyond our work on nuclear weapons and nuclear power to deal with threats such as global climate change, as well as toxic degradation in the environment. Throughout the 1990s and extending forward, we had a number of campaigns as evinced here, and my own state of California, for example, like many of our state chapters did, we issued reports such as Degrees of Danger, How Smarter Energy Choices Can Protect Our Health in California. So in a lot of ways, this is really old stuff that we're doing, but we have a particular import of stressing these issues now. We know that the public health effects of climate change are largely unaddressed. They include that it's happening now, the costs of inaction are high, and a prevention approach is key for public health and safety, preparedness and response, and for community resiliency and recovery. All things that I think have been very well talked about by the other speakers. And in terms of the renewed prominence, to many of us this is not such a new story. Certainly events such as Hurricane Katrina in New Orleans, Hurricane Sandy here, have given new prominence to the particular role that health professionals can take. And this is from last year, reflecting on the renewed emphasis on that in the wake of Hurricane Sandy. Rebranding climate change as a public health issue. This is in Forbes, and this is also in Forbes, that healthcare needs to lead the fight against climate change. And Wendy spoke about Jeffrey Thompson, who's a very foresighted leader at Lutheran Medicine Hospital, and Gary Cohen on the left is the CEO of Healthcare Without Harm. And this has represented a very dynamic movement within healthcare institutions, recognizing, as other people have spoken about, that healthcare is a significant industry, it's a significant sector. If you get them if this industry to change its habits so that we can go beyond what the original Coalition of Healthcare Without Harm was doing in terms of reducing hospital-based pollution, to actually move towards a variety of systematic change in terms of what type of energy do you use, what type of materials you use, et cetera, et cetera. We represent a big industry that can give leverage to significant market changes on food and all other things that could benefit a healthy environment. And many of the healthcare institutions have joined this, as other people have said, because they recognize just at the bottom line, not only is energy cost too much, et cetera, but there's a recognition of the burden of chronic disease that healthcare institutions and the whole industry has to deal with. So a lot of the drivers on this are referable to the co-benefits that concur on public and environmental health by making these changes. So we think the healthcare sector can play a key role in terms of encouraging green practices and the energy efficiency that we've talked about, provide materials to our patients and physicians alike to up the level of education and engagement, and also to make very concrete recommendations to hospital systems with that clinical voice that has such impact. And again, I gave a very brief focus on the work of Healthcare Without Harm that's been around for about 15 years, and we're just really spearheading efforts like that. Our chapter in San Francisco and many other in our network around the country has been working in partnership with Practice Green Health and Healthcare Without Harm for many years, having concrete ways that we can reduce our imprint. This is like working on green teams. And not only does it, actually come up with sector changes that really make a difference, in my view, it allows us to intersect with the very busy health professional at the place where they work, because it's hard to get the engagement when people are so busy in our very dysfunctional healthcare system. Very prominent has been the Healthy Hospitals Initiative that has all of these major institutions that are currently bought in for the same reason. The goal is to enroll 2,000 hospitals. It's free. All these materials and ways to change these hospital practices are free for those institutions that enroll in it. And this map gives a quick overview of hospitals that enroll. There's much more that needs to be done to make this effective and to really drive the changes that we need to see. As you can see on this slide, all of these aspects are dealt with within this type of systematic sector report. To engage the leadership at both the clinical and administrative levels, to have less waste, safer chemicals, healthier food, leaner energy, smarter purchasing. All of these things mutually reinforce each other to make a major potential change in it. Part of driving this in terms of educational efforts among healthcare professionals has been what has been developed, a climate and health literacy consortium, so people get educated like all you are here on these various issues. There are slide presentations like this national webinar that I gave 2 years ago, climate change and the role of healthcare professionals. You can update these, you can add your own materials to it, so this is fresh and engages people with the newest information. And you can see, we've been able to mainstream this stuff by all of these organizations have supported it. I know for myself, 15 years ago when I was trying to give climate change grant, to talk about climate change on grand rounds, the big hospital types of fora, you couldn't get in. This was too political. Having all of these organizations, CDC, American Nurses Association, American Medical Association, support materials like this gets a lot of credibility among rather conservative health professionals. So what role do we have overall to stand up at a time when this whole issue has been so politicized, and in this case, we're hoping that people will trust their doctors and other health professionals. So these are some of the things we want to inform, educate, and engage, lead by example personally, professionally, advocate for development and implementation of policies across the state, local, and federal levels, engage decision makers, and get information out to our colleagues and networks, collaborate with professionals outside of our sector. One of the ways that I know from my own personal experience and some other PSR chapters is to be engaged at the level of the County Medical Association. Again, these are people in your own community, if you're a health professional, or in local public health associations that you could work together to make this change. We in San Francisco have developed a very wonderful relationship with the San Francisco Medical Society, for example, that now there have been 3 or 4 issues such as this that are targeted towards health professionals that go through the gamut of positive change that you can make on energy, healthy food systems, etc. So for example, again, going to mainstream physicians in San Francisco, Climate Change for the Better, Linda Birnbaum and John Valdez. And we've worked at the level of policy, food and chemical policy, that I just wanted to profile a number of the resolutions that we've gotten on climate change and human health, air pollution, and one on hydraulic fracturing last year that again ups the level of conversation and allows these organizations to actually speak out. So again, American Medical Association, American Nurses Association, and the APHA, the largest and oldest public health association in the world, are all speaking on this, and this has real consequences. So AMA, of all places, said that sent a letter to President Obama in 2009 urging him to take the strongest possible steps at Copenhagen. He obviously didn't go for that, but nonetheless, it illustrates the potential. Here's a major AMA and APHA getting together. So these are incipient steps that forge a very broad and strong coalition. We've, at PSR, a number of us have gotten, for example, articles into the medical literature. Cindy Parker is the co-chair of our Environmental Health Committee, authored Slowing Global Warming, Benefits for Patient and the Planet, to make this case to the American family physicians all around. These are thousands of physicians who read this. She came up with very clear guidelines that you can go over with your patients in the damn 15 minutes that people normally have. But these are real things. How do you come up with the best recommendations to make those changes? In this case, she concentrated on food. And I commented on how much is what I'm talking about here relates to engagement at the hospital levels. Other issues that relate to it, they're not strictly climate change as such, but another major issue profiled various issues of chemical policy and other pollutions that of course are associated with fossil fuel use in terms of the chemical industry, but it's another way to organize physicians who are more organized on chemical policy, say. We have been working for 10 years in partnership with the American Academy of Pediatrics, which is the Pediatric Environmental Health Toolkit, to train pediatricians. We offer credits for it, and this is a way that they up their level of being able to talk to their patients about lead and mercury and a whole host of other issues. My own program and the program on reproductive health and the environment that I'm Director of Health Professional Outreach and Education for at UCSF in San Francisco is another way that we've been able to get this word out, as well as related climate change issues to our fellow physicians, particularly the OBGYN community, with materials like this, which up the level of discourse, engage the physicians and get them working on policy. A very profound thing in terms of bolstering our ranks was a committee opinion that we worked on with the American College of Obstetrics and Gynecology, who up until this point, the 56,000 OBGYNs in this country never discussed environmental health issues, unlike the pediatricians. With this committee opinion, which forms the basis of clinical practice, now these members have to really be in line with their organization. When they see a patient, they have to frame their clinical approach with environmental health. And the basis of this, also the supporting papers for this document also dealt with the impacts of climate change as well. And as a result of that, ACOG and the American Academy of Pediatrics joined in letters to Congress this year who are concerned about chemical policy to make a real impact in having health protective chemical policy. Again, this is a way to get these professionals involved in a whole range of environmental health issues. I wanted to close with just some remarks about the extraordinary work that's been going on here in New York State with concerned health professionals of New York. I participated in a panel a few months ago with Sandra Steingraber and others in San Francisco on the release of this compendium of medical and health effects associated with fracking, which is certainly overlap with the chemical toxic issues that I was talking about just a moment ago because of the toxicity that the materials involved in fracking represent. One of the things that came out, which is extremely important, is a case that these health professionals made for a comprehensive health impact assessment. That is Larissa Deriska, who works here in New York State, has done on multiple PowerPoints, and she's traveled all over the country, talk about when we're talking about whether it's climate change or fracking operations, you have to look at the whole life cycle of these practices and the impact on public and environmental health. And their organizing has been terrific. They engage all of these county medical societies in New York State, as well as chapters of American Academy of Pediatrics itself, to form a very broad coalition that has led to, at this point at least, the blocking of moving ahead with fracking operations in New York State. I'll just close and recapitulate a little bit what Catherine was saying. We have additional information, including some of what I just mentioned, in terms of our webpage about hydraulic fracturing with a number of educational materials, brochures, whatever, guides to doing op-eds that anybody who wants to very easily weigh in has that ability to do. And the last thing, again, recapitulating what Catherine said, the real import, although we understand it's not perfect, to weigh in on the EPA rule. And again, to underscore what Catherine said, even though it's not specifically dealing with things like natural gas and fracking operations and methane, you could weigh in and you should be able to tell them you have to concentrate on all of these things because we need a healthy planet, and that's what it's all about. Margaret Chan in 2007, the Director General of the World Health Organization, said the health sector must add its voice loud and clear. We must fight to place health issues at the center of the climate agenda, etc. Just a few days ago, representative of how slow things are really moving and underscoring the real import of what we do, she said, and how climate change can rattle the foundations of public health. Here's my strong view. Climate change and all of its dire consequences for health should be at center stage right now whenever talk turns to the future of human civilization. After all, that's what's at stake. And I just put that charge to all of you, whether you're health professionals or not. We really need to take the boldest possible stands on this. And in my own view, as many of the discussions have been going on here today, very integrated with other things that PSR is working on in terms of